So let's continue on. We are still on the thyroid gland. So the thyroid also secretes calcitonin. So the parafollicular cells of the thyroid gland secrete a hormone called calcitonin. Calcitonin helps regulate blood levels of calcium and phosphate. It is secreted in response to increased blood levels of calcium, and it stimulates osteoblastic, which is bone-making activity in the bones, thereby moving calcium from the blood into the bone. It is an antagonist to the parathyroid hormone. So now let's talk about your parathyroid glands. So they are 4 tiny parathyroid glands, and they secrete PTH. The stimulus for the release of PTH is low blood calcium. PTH has 3 target organs: bone, digestive tract, and kidneys. The overall effect of PTH is to increase blood calcium levels in 3 ways. So number 1, PTH increases the release of calcium from bone tissue called resorption. It does so by stimulating osteoclastic activity, and in response, calcium moves from bone to blood. Number 2, PTH stimulates the kidneys to reabsorb calcium from the urine. At the same time, PTH causes the kidneys to excrete phosphate, which is called the phosphoretic effect. So as phosphate levels decrease, calcium levels increase. And as phosphate levels increase, calcium will decrease. Thus, to raise blood calcium levels, it is necessary to lower blood phosphate levels. Number 3, working with vitamin D, your PTH increases the absorption of dietary calcium. Number 4, blood calcium levels control the secretion of both calcitonin and PTH through negative feedback control. So an increased blood calcium level, it stimulates the secretion of calcitonin, and in a decreased blood calcium level, it's going to inhibit secretion of calcitonin, and it stimulates secretion of PTH. So PTH deficiency. So with insufficient PTH, blood calcium declines, causing hypocalcemia, and muscles remain contracted. Sustained skeletal muscle contraction is called tetany. So hypokalemic tetany contorts the wrist and the muscles of the larynx, called a laryngospasm, and the breathing muscles. Inability of these muscles to relax cause asphyxiation and death. So let's rethink. What is the most important effect of PTH? It increases blood calcium levels. Number 2, list the target organs of PTH. Bone, the digestive tract, and the kidneys. And number 3, why does a deficiency of PTH cause hypocalcemia and tetany? The nerve and muscle membranes become unstable and continuously fire electrical signals, causing the muscles to remain contracted.